If you're a doctor and you need care for your Medicare-aged patient and you're trying to get it as soon as possible, you're probably frustrated with one thing: face-to-face. If you're a patient and you need help for yourself or for your loved one and you're Medicare-aged, you may be frustrated with one thing: face-to-face. In this episode, in this quick video, we're going to talk and explain about what the requirements are for Medicare patients when they need home health from the doctor's perspective and also from the patient's perspective. It can be very frustrating, but let's make it easy. Let's make it smooth. Let's go. All right. My good doctor, my good friend, let's talk to you for a quick second. Let's talk about how, whether you are a cardiologist or a PCP or a pulmonologist or even an oncologist or any specialty doctors, you are seeing your patient, but then your patient needs more help at home. And you're thinking that they would need some home health. One of the things that may be a little bit frustrating is the face-to-face requirements that are necessary within your evaluation of that patient to get the care that they need. Medicare has these requirements. It's mandatory. It's necessary. But a lot of times, no one takes the time to educate you. And so, therefore, that face-to-face is extremely frustrating. And you don't know how you need to do it, what it needs to have, what the documents, the sections of your progress note, things like that, the timing. Maybe you didn't see your patient for like 6 months, and now you got to have your patient come and see you. And you're like, what's going on? The patient just needs help. How come they just can't get help? We're going to talk about it. So I'm going to pan over to a quick iPad drawing, and we're going to draw with some diagrams to walk you through that. And then after that, I'm going to talk to my patients, the people in the community, you. I'm going to talk to you, and we're going to talk about what does it look like for you when you need help, and how do you get that started? And then we'll pan over to a quick diagram, and then we'll go from there. Hopefully this helps you and can make it really clear for you, and get that face-to-face a little bit clearer. So you can see face-to-face, right? All right, so let's get this going. Pull my iPad here. Let's talk to doctors. Let's talk to PCPs, which is also known as primary care physicians, cardiologists, oncologists, pulmonologists, all the specialty doctors. Those doctors are usually an MD or a NP, nurse practitioner, PA, or a DO. All right, so let's look at a span of a couple months: January, February, March, April, May, and let's stop at June. So let's say you see your patient in January, a little smiley face, and the next time you see them, actually don't see them, but they have a fall that occurs in June or a change in status. What do you do? What happens? That's a long time between January and June for you not to see your patient. And it's greater than 90 days. That's a long, long time. All right, let's flip over here. We'll draw a little line. So let's say, you haven't seen your patient for that long. Before care starts for home health, you have to have seen your patient, and that is a face-to-face. So F2F, face-to-face, that's a face-to-face visit with that patient. A progress note and an order is done during that time for home health services. All right, so let's draw a little picture of a sheet of paper. We're going to signify this as an MD progress note. So in that actual note, there's 3 things that you need to consider as a doctor. You need to consider narrative, as you know exactly what happened and what's going on with that patient, an explanation of care. The second thing is there needs to be a skilled need. So a nurse needs to help, PT, OT, ST, and the patient has to be homebound, which is it's hard for them to leave their home, and it creates a taxing effort. Third thing is an order must be written for care by an MD, and there must be a specific signature by the MD stating that this care is needed for them. All right, so let's talk to patients. Let's talk to a patient in the community, and let's break down what does that look like from the patient side. So you haven't seen your doctor since January, and this event occurs. like we talked about, in June. That is greater than 90 days. And so that is not within the requirements for home health. So you got to set an appointment. Reach out to your doctor and set an appointment. That could be a first face-to-face, or it could be a virtual. But the virtual must be audio and it must be visual per Medicare requirements. The doctor's got to see you and you've got to speak to them. And then an order is written that's deemed by the doctor within the progress note, and it's sent to the home health for care to get started and for you to get the help that you need at home. That is that face-to-face that is needed prior to care. And that face-to-face can either be done in person or it could be virtual with audio and visual. All right. So my good doctor, my good patient, good friend, I hope this helped you understand a little bit more about face-to-face and helped clear up the fogginess in the mirror when it comes to face-to-face for healthcare at home. If you like this, please like, subscribe. Also, we have a lot of information on our YouTube channel and our website, and our heart and our goal is to educate you and help the healthcare industry be a little bit more clear when it comes to the needs that you need for your loved one or for your patients. So see you guys next time.